is your pharmacist Sidra, and in this episode of responding to your comments, I will be answering some of your Instagram questions in a YouTube video. By the way, if you don't follow me on Instagram, it's askyourpharmacist.sid. And if you have any questions that you would like me to address, it's much better to ask me a question in comments because sometimes my DM literally gets a bit flooded or the messages simply just, get overlooked. But I really prioritize the questions in comments, so leave them there. So now, without further ado, let's get to the questions. The first question that we have is from @BarrySimmons98. Can you tell what is the best way to get rid of earwax? Well, that's a great question. First of all, I want to make this very clear that earwax is completely normal and healthy, and actually it has some antibacterial and antifungal properties, and in a sense, it's like a part of ear's self-cleaning mechanism. And some people think that earwax is dirty and it needs to be cleaned. Well, in normal circumstances, it's not. It's absolutely normal. We all have it, and it is supposed to be there as a part of our natural protection. Becomes a problem only when it's just too much earwax to a point where it's uncomfortable. Some people get hard at hearing because of the earwax buildup, and that's when the earwax must be cleaned. One thing that we've all heard is not to use cotton bud or a Q-tip to clean earwax, and that's absolutely 100% true. And there are some of other very effective ways to clean earwax. First one being just use a couple drops of warm olive oil. Now you just instill like maybe 5 to 6 or a couple drops of warm olive oil in ear canal, and you want to let it sit for a couple minutes. It's gonna soften the earwax, and then the earwax can simply be removed using either a suction bulb or some of the earwax removal tools, like they have an earwax spoon, ear pick, or an earwax removing scoop. However, it is very important to be very careful with these tools. You want to make sure you're being very gentle to avoid any damage to your ear. Just one thing to remember is not to use this method for long term, as olive oil used in air for extended period of time can actually lead to even more buildup of earwax, which you don't want. So in that case, I would recommend using another method and use an over-the-counter medication known as Debrox to clean the earwax. Debrox is very effective. You simply instill 5 to 10 drops of Debrox into the ear. Just remain in tilted head position for a couple minutes just to make sure that the drops go in all the way. And then this is gonna loosen their earwax, and you can simply afterwards pull it out using a bulb syringe. @Cookie3 we ask, what is the best under eye patch for puffiness? Is there something for dark circles? Well, there are so many under eye patches available in the market that claim to reduce eye puffiness, but the one that I personally love the most is from Skin Beauty. It's called the Iceland Hydro Cooling Patch. I'll put the name on the screen for you. This gel patches are so good. They're literally infused with glacial water and peptides, botanicals, and that literally work to reduce the puffiness and firm the under eye area. They feel so cooling and soothing for your eyes. It kind of gives an instant result. Another one of my favorite is from Wonder Beauty. These are the gold eye patches. These gold eye patches literally contain hyaluronic acid, aloe leaf extract, and lavender oil, which all kind of helps to hydrate and soothe the under eye area while reducing the puffiness, which is the ultimate goal. Just another thing you can do for your under eye puffiness is put your eye cream or eye patches in fridge and apply them very cold on the eyes, because this is gonna give you an instant like awakening effect Also, the cold patch that you, or the cold compress that you're gonna apply on your eye, basically what it does is constrict the blood vessels, and that reduces the puffiness or swelling under eyes. The cold compresses also help with the dark circles. Now, as far as something for the dark circles is concerned, honestly speaking, I am yet to find something that genuinely helps, because I myself have really bad genetic dark circles, and I've tried pretty much everything under the sun, serums, creams, nothing really helps. So my go-to solution honestly is just put a concealer that I know kind of puts just a band-aid on, not the most effective remedy that you were expecting from me, but hey, that works for me. I mean, there are other options in terms of you can get like laser treatments, or you can get certain like Botox injections, because often the dark circles are just the reflection of the the veins underneath your skin, and getting like an injection or a filler sometimes does help, because then that wouldn't reflect the dark light on the skin. So something to keep in mind. But for me personally, I am very conscious about the sensitivity of the under eye area, and I don't want to experience anything or take a risk for that sensitive area, because I have personally seen so many kind of horror stories, and I know that's not always the case, but you know, that's just my personal opinion. I am not touching my under eye area, not getting any needle near my under eye area. But if you guys know any other effective serum or cream that claims to, not really claims, but you have personally tried and literally helped you get rid of the dark circles, do let me know, because I would love to give it a try. Alina Zia 6 has a question that please make a video on post-operative care. I think it's a great question, and the video on this topic was long due, because I think post-operative care is essential to ensure a successful recovery after any surgical procedure. Now, overall post-op care will vary from surgery to surgery, but in general, you want to follow the set of instructions that your doctor has provided you. It could be, you know, specific wound care that your doctor recommended. If the surgery involved giving you anesthesia, then something to keep in mind is that you may experience very bloating, burping, or just pain in your shoulder or just muscles, because what happens is when they give you the gas, the anesthesia gas, that moves around in the body, and this is totally normal, nothing alarming, and this movement of the gas is going to result in pain. So but if you just give it a couple days, this pain will go away. But in general, pain management is totally very essential. Depending on the severity of the surgery, just ensure that your pain is being very well managed with the medications properly. Often for pain management post-op, opioid medications are prescribed, and these medications cause a lot of drowsiness and are habit forming. So make sure you don't overdo on these medications. Do not take them around the clock. These are only for extreme excruciating pain. I often recommend patients to use or reserve these pain medications for nighttime pain relief, because often the pain is more excruciating at nighttime. During the daytime, you can ask your provider for some non-drowsy option or non-opioid option. That way you can still be up and do a little bit of movement if that's recommended by your doctor, but you don't want to hook yourself on the pain medications, especially if they are opioids, because then your body literally becomes dependent on it, and it only takes up to a week of constant use of opioid medications for your body to get kind of addictive to the medication. So something to be very, very cautious, because I have seen so many patients who start taking the opioid medications as just like a post-op care, and then years to come they are still on the opioid medications. Now, don't get me wrong, Sometimes it is essential for the proper pain medications, because often even after surgery pain still exists, but you have to be very, very cautious when it comes to the use of opioid medication. Another key thing for post-op care is to monitor for any signs of infection at the surgical site. Infection is one of the biggest risks after surgery. So you want to watch out for any infections such as, fever, redness, swelling, or discharge from the surgical site could be a sign of an infection. So if you see any of this, definitely report it to your doctor immediately. And to prevent any infection, make sure you keep your surgical site very clean at all times. Maybe use an over-the-counter antiseptic soap like Hibiclens to wash off the affected area or the surgical area if it is approved by your doctor. Often your provider or surgeon will prescribe you a course of oral antibiotic post-op. Make sure when you are taking an antibiotic, you finish the full course of it, even if you feel better. Also, you want to avoid any strenuous activity. Rest is crucial because you want to give your body some time to heal and go back towards its normal routine. Another important thing in post-op care is eat healthy. Increase the protein intake in your diet. A healthy diet can literally help support the healing process. Eating a well-balanced diet really includes plenty of fruits, vegetables, loads of protein, because that's going to help build up the muscle and help in the healing process. But definitely nutrition plays a big role in the recovery from any surgery. Alright, so those are the questions that we picked for today's video. I hope it was helpful. Remember to write your questions in the comments and I will try my best to answer all of them in these weekly videos. I hope to see you guys next time.
Hey guys, if you found value in this video, give it a thumbs up, share it with your friends and family, and remember to subscribe to stay up to date on new weekly videos.